Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about exercise and the lower extremity. This can be a big deal. There are three areas that I'd like to discuss when it's concerning exercise. Number one is the benefits. There are huge benefits to exercise when it comes to the lower extremity and when it comes to health in and of itself. One of the big benefits is improving the functioning and the health of the circulatory system. So it improves the heart, improves cholesterol levels, includes blood pressure, improves overall the blood flow and carrying of nutrients throughout the body to help it function more like it's supposed to. It decreases problems such as varicose veins and blood clots and those kind of problems. So it can be a big deal when it comes to just the lower extremity and exercise itself. Number two is it actually helps you to feel a lot better. There are neurotransmitters released, dopamine and anandamides, that improve the feeling of pleasure and bliss and just overall feeling good. The runner's high comes from these chemicals, but it also can help you so that your mind functions more like it's supposed to. You can get the release of norepinephrines where you get a better focus. And so just these neurotransmitters, not mentioning some of the others that are released, can make a huge difference in how you feel and how you present to the rest of your life. So exercise can be very beneficial. Number two is the risk. There are risks with exercise. I mean, if you have diabetes or other causes of peripheral neuropathy or numbness to the feet, you can actually have injuries without knowing it. You can actually get sores, blisters that become wounds, and can be a big deal. Likewise, you can get an overuse type injuries where you can actually get strains or sprains or even stress fractures to the area that can be a big deal. So there are risks to exercise, and so you have to be careful with how you do it, not overtrain or not progress too quickly, but to actually do it appropriately. Number three is prevention. How do you make sure that you're doing exercise appropriately so you're actually doing what you should do? Number one is making sure you have appropriate or correct equipment. When you're exercising, you want to have the equipment that is appropriate for that activity. Running should use running shoes. Walking should use an appropriate walking or running shoe. Tennis, the appropriate shoes for tennis, and so forth. By wearing the appropriate equipment, you decrease the chances of injury. Number two is training correctly. We mentioned this a little bit as we were talking about the benefits, but you can overtrain and actually increase your chances of injury. You can also progress training too quickly and increase the chances of injury. And the third is making sure that you have the appropriate nutrition and the appropriate fluids when it comes to exercise so that your body's functioning at its peak. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 308.